I will be discussing the Hyde Amendment and abortion in the United States. Does anyone recognize who this is? This was Rosie Jimenez. She was a young college student and single mother with 2 children, just months away from receiving her teaching degree. She was also the victim of septic shock as a result of an unsafe abortion. Her horrific death was the first to prove that the archaic abortion practices of the 20th century were not over after the passing of Roe v. Wade. According to the Guttmacher Institute, 1 in every 4 women in the United States will undergo a legal abortion procedure in their lifetime. Before they turn 45. So there's a very high probability that everyone in this room has met an abortion patient. If you are unaware, the case Roe v. Wade makes abortion legal up until fetus viability. Planned Parenthood versus Casey bans an undue burden upon women trying to have an abortion. Undue burden is defined as having the purpose or effect of placing substantial obstacle in the path of a woman seeking an abortion of a fetus that is not yet viable. The Hyde Amendment prevents government-supplied health care, Medicare, from paying for abortion services. It also prevents any federally subsidized or funded insurance from financing abortion care. This means that patients who are poor and low income aren't financially helped when they need an abortion procedure. Many states block both governmental insurance plans from financing abortions and private insurance plans from financing abortions. Oregon is not a state blocking private insurance from paying for abortion, but many other states are. Women who are below the poverty line are more likely to be in a place of unintended pregnancy. This means that the poor and low-income women are not accessing abortions and reproductive care within the frame of 20 to 25 weeks during their fetus viability. This is usually attributed to the lack of transportation, lack of money, or inability to take off work. The Turnaway study finds that women who don't receive the abortions they wanted or needed result in a higher risk of lacking the physical, emotional, and financial abilities needed to raise a child. I propose that the government should pass the Each Woman Act to bring necessary reproductive health care to all women. The Each Woman Act requires government insurance to pay for women's choices to get an abortion. This plan is backed by both Senator Jeff Markley and Senator Ron Wyden of Oregon. It bans federal and state level legislature from preventing private insurance from paying for abortion services. This would enable women below the poverty line, women in the military, women with benefits from Medicare, Native American women, and women who are operating under government-subsidized insurances to receive the reproductive health care that they deserve. It would also prevent the states from passing laws that ban private insurances from funding abortion under their own guidelines. This plan would cost more money to fully insure women working for the government and benefiting off Medicaid. It will, however, be worth these costs to bring women under the poverty line and working for the government out from under the undue burden that is placed upon them. Once this plan is signed into law, it will be maintained by the federal government and imposed into health care law and onto state law. Women are smarter, more financially stable, and more productive when they can make their own reproductive choices. According to the American Journal of Public Health, women are more likely to complete school, especially in cases of teenage pregnancy, and when women are forced to pursue a pregnancy, their economic status is damaged for years until they can regain the same levels of employment. Native Americans, women of color, and Latinas are disproportionately affected. This bill would allow them to have the same opportunities that the white, cis, able-bodied, and economically advantaged populations have. The United States government should pass the Each Woman Act in order to improve the status of women in the lower socioeconomic statuses and women employed by the government. The current system is contributing to the health gap between the wealthy and the poor. You too can help women receive the care that they need and deserve by voting for politicians and leaders who are in support of the Each Woman Act. Thank you.